we're currently undertaking is really looking at ways to, I guess, educate professionals, not only in the space that are looking at planning and policy, but also health and individuals. So I guess we better understand and actually see our built environment as public health. So yeah, I would say for me, that's probably at this point in stage, one of the biggest factors.
Terrific. Thanks, Kate. It's interesting. There was some work done by the company's name just flipped out of my head, but there's a large, it's called ARUP, A-R-U-P, however you pronounce it, an organisation worldwide that works around the built environment. And they put out a policy document a couple of years ago, which was in connection with a number of organisations looking at built environment and older people, particularly in reference to age-friendly work. And I guess that's the built environment is one of the platforms under the age-friendly program. And if you're not aware of that, we can talk more to it. But that's a really interesting observation, how you're connecting physical activity and the built environment are really important. Anyone else want to talk either on that thread or another particular thread that you're working around? Come on. Yes, Christian.
Hi, everyone. Sorry, I didn't quite catch how to raise my hand in Zoom.
On the right-hand side, you should have a panel and there's a number of symbols about midway. There's one that says raise hand.
Okay, I'll investigate that in a second.
Well, but go for it now.
Yeah, thanks, Sue. Thanks again for the opportunity to come along today. My name's Christy Gardner and I work in academia. I'm a lawyer in Australia, so in the region, and am now employed by the University of Newcastle. I do a lot of research around human rights and older persons and increasingly around age-friendly environments. In terms of challenges to healthy ageing, I have a new contract with Routledge, which will be, for an edited book on, we call it the age-friendly lens, and it's trying to move the age-friendly environments conversation into a range of different, I guess, non-traditional domains beyond those scholars that work in the built environment and the health sectors. So for me, as someone who's pulled together the collaborators from around the world on this topic, what I have found is that there's this, I guess, uncertainty around what I would call task responsibility for healthy aging from a policy and an implementation point of view. In the legal space, task responsibility, of course, is not necessarily something that's been picked up for the concept of healthy aging, which we traditionally see as being the domain of health practitioners and those traditionally researching the experiences of the physical experience of aging in that sense, not what it means to live in an environment that supports that concept. So task responsibility is probably one of the issues that I think I have seen arise, but not necessarily isolated to the Asia Pacific region. And another is, I guess, academic responses to this issue. We always have in academia an issue of effective collaboration, breaking down those traditional silos of research, trying to access grants and opportunities in that way. So I think as researchers, we tend to all have a common interest, but we are approaching things from our unique perspective, which is fantastic, but trying to come together and effectively collaborate to implement some of these strategies that the WHO have for the decade of healthy aging, something that I think needs to be supported. But they're the two sort of takeaways that I have at the moment. Thanks, Sue.
Thanks, Christy. They're interesting observations, and I know Tars well from over the years, and certainly having that legal perspective and the discussions with the IFA around the Convention on the Rights of Older People, and I've been fortunate enough to go to a number of those meetings in the UN, and we still haven't got the convention, but maybe we're inching forward. But seeing it from that perspective brings an interesting lens that we haven't necessarily had in the age-friendly discussion that robustly. So that's great. Thank you. Deirdre, you've unmuted. I guess that means you've got your hand up.
Well, I have actually pressed raise my hand and it's up there, but I don't know what's happening.
If I can. Well, good. I'll look for it. Thanks. But go ahead.
Okay. I'm from Western Australia, and our organisation protects the rights of older people in our state, and we also staff the state elder abuse helpline. So from the work we do and the work over the years I've done in aged care, I think our biggest challenge to ageing well is the ageist attitudes of society and seeing older people as other. And we have a whole lot of negative stereotypes, which actually works proactively against ageing well and removes rights and dignity for older people. So any work that we can do around the rights and that Convention of the Rights of Older People, I think is incredibly important.
Strength to your arm, Deirdre. That's all I can say. Yes, you've hit on one of my passions. Well, they're all my passions, but yes, ageism does deny us the opportunity to live the life fulfilled as we age. And so the lack of rights, the lack of respect, the lack of opportunity to be who you want to be because of ageist attitudes is certainly undermines just about everything else we want to do, doesn't it?
Yes, I did a presentation at a national age-friendly communities conference, and I have to say that that was one of the most receptive audiences I think I've ever presented to, and it was really heartening because their local government authorities really connected to community. But I did a bit of an interesting exercise with them around ageism, and it's interesting for yourself. I don't know how many people want to speak and how much time I've got. But it was
a couple more minutes and they might see who else is wanting to have a say.
It was just about, I stood up and I said, okay, I just want you all to guess how old I am. And there was a whole lot of, you know, perplexed faces and expressions. And I said, well, look, just to the year, you know, it doesn't have to be to the day. And then went on with a bit of my presentation. And then I said, look, I've come back to this now and you've decided how old I am. And now I want you to find the descriptor for that age. And then I did a bit more presentation. I came back to it. I said, okay, so now you've decided how old I am and whether I'm old or middle age or whatever I am and all the stereotypes that go with that. But then I said, actually, I've recently turned 65 and that was fine. The sun still came up. I went off to work, you know, all these sorts of things. But then people started asking me when I was going to retire because of our retirement age conversation. And that I found very challenging because for the first time, people were taking my age and deciding which part of society I fitted into.
Yes.
And, you know, I think we all do that. And how do we actually call it out? I think as we get older, we need to be proud of how old we are and what we do. Yes, that's just what I want to share.
Yes, thank you for those observations. And I think there's many truisms that we tend to rally against ageism, but sometimes struggle with it ourselves in terms of what does it mean for how we respond to things, etc. So we need more understanding, more language, and a shift in a number of things to help us on that journey to battle against ageism. Thank you. Who else would like to have a say? I see Mark Tucker-Evans is sitting there. Mark, anything to say?
Hi, Sue. How are you? Nice to see you again.
Thank you.
Just picking up on something that Kate was saying earlier from the Heart Foundation in Queensland. As you would certainly know, and as some of the other people online may know, CODA Queensland, along with the other CODAs, have been advocating for an age-friendly Queensland for over a decade. We're now currently working with the local government association in Queensland, and we'll actually be hosting a age-friendly conference with them in July. We also work with a number of organisations, including ARIP, which you mentioned earlier, in terms of the built environment, because we certainly see the built environment as being a key to enabling people to age in place. So I look forward to catching up with Kate and just talking a little bit more about how the Heart Foundation and CODA can work together to promote the walking groups. I know through a committee that I chair up at Brighton that a walking group has been actually started up there to assist with older people staying healthy within their own communities. But I might leave it at that at this stage.
Great. Thanks, Mark. The IFA conference is coming up and most of you will know about it, but I'll put in a plug for it. We have our conference in Toronto in early November, 4th of November, Vanessa, I think.
Yes.
Thank you. One of the threads, very importantly, in that is the age-friendly work. And so I would encourage you all to think about whether you can get yourselves there and bring the fabulous conversations that we're having toward that. But I guess one of the things I'm also interested in for those who either will make it or can't but want to contribute is we can have these sorts of conversations at times that suit people and contribute through this process into that conference. And also then post-conference, we could have a session looking at what we learned and what we want to share. And also in terms of the decade of healthy aging, we can take threads out of that. And obviously the age-friendly environments is one, but we can take threads and have specific sessions for those of us who are interested in the different elements of the decade of healthy aging and look at ways we can actually be spreading the knowledge about the decade of healthy aging. When it first came out, I sent it off to a number of local governments in Victoria, and it was like, people were like, what's this and what do I do and how do I get engaged in it? And so I think there's some merit in us taking some leadership in that. So that's great, thank you. Who's not in Australia? We've heard quite a bit from Australia. Who's not in Australia that would like to have, yes, Jeff, welcome. You need to unmute yourself. Bottom left hand, yeah, great. Yes, Jeff.
Well, yeah, it was very pertinent this morning. I opened the Otago Daily Times, which is our local newspaper, and I've posted something on LinkedIn if anybody wants to have a look at it. And our Office for Seniors has done a great thing. They've commissioned a number of articles on how older people are coping, or the issues that older people are facing as they age. And a physiotherapy PhD had written an article, which was a reasonably good article, but the ODT decided to put a headline on it, Better Attitudes to Aging Enhance the Autumn Years, which really got me rather incensed. And I've now written a letter to the editor and broadcast it all over social media. And I think it's just one of those things that sits there that the narratives that we use are the narratives that will define how we think about age and our own processes of aging.
Yes.
And I had thought that the Silver Tsunami narrative, the narrative about the latter years that was picked up there, is one that had disappeared. I was tempted, but didn't, because it would simply reinforce the narrative to go back and say, well, when do the leaves fall off? And you know, and when does this stage start? So I think there's always the challenge there, and I think one of the challenges in the question that even you've posed, Sue, and the way we've responded to it, is that we've responded to healthy aging by still talking about the aged. And it's the same when we talk about longevity. We immediately talk about the extra period at the end, rather than simply seeing longevity as affecting all stages of life. And I think we've got to broaden the discussion around healthy aging to engage people to remain healthy as they age.
Yes.
And talk much more about the process. So what does it mean for you as a 30-year-old, as a 40-year-old, to be healthy as you age?
Yes.
Rather than simply, whoops, I've got to this life stage where, oh, I need to think about my health.
Yes.
So I think it's a broader challenge than that. And I think the other piece that I've been talking about more too is I'm totally supportive of the age-friendly initiative. The only hesitation I have is the moment we think age-friendly, we think older people. And so more and more in the work I'm doing with workplaces, which is where my practice is, I'm talking more now about age inclusiveness.
Yes.
And so what does it mean to be an age-inclusive workplace? What does it mean to be an age-inclusive community? And that to me seems to be more embracing than age-friendly, which is still a little bit about the other.
Yes. And I think
that's just some observations and comments.
Yeah, no, look, and all good. And I think we can fall into that trap, even though at times we pull ourselves out of it. And certainly one of the conversations I've often had is around that you have to live long enough to get old. You know, so it's important that you also have the foundations throughout life that give you a good old age. You know, so it is a life course experience, not a, oh my God, I'm, as you were saying, Deirdre, I'm 65, how did that happen? And look how people are treating me. I mean, it is a lifelong thing that we need to work in.
Well, just another couple of comments on that. Our Minister for Seniors here in New Zealand has, towards the end of last year, launched a new strategy for an ageing population and had some involvement in it. But I think what is inspiring about it is that it's actually entitled Better Later Lives. And it's moved away from older people or senior citizens to an actual fact. And what she wanted to do was she actually wanted to engage people in their 40s and in their 50s, not suddenly turn 65, and I'm over 65 now. And if it had been called something to do with that, I would have never engaged with it. So the message really is if you want a better later life, you need to be thinking about it right the whole way through. And the other thing we did when we were actually working on critiquing it and editing it was to change anything that talked about 65 plus or older people or a category to that phrase that I've just used, as we age. So I'm much more involved now in thinking about what does it mean to have a better later working life? Not what does it mean to be an older worker, but what does it mean to have a better later working life? And that seems to change our narrative and our way of thinking and challenges some of the ageist language that we actually use ourselves.
Yes. Yes, and I think that's a really important observation, and I saw Deirdre stick her thumb up. So, but it is about, language is so powerful, and our thinking needs to be reshaped and constantly challenged. And even though all of us are interested in this topic, we all need to challenge our own thinking and our own and others' thinking, so that we continually expand, develop, shift, and rewrite the future for all of us.
Well, it's rewriting Mexican too.
Can I make a comment, please?
Yes, Kathleen.
Hello, my name's Kathleen Brasher. I'm leading the Age-Friendly Rural Communities Initiative in Northeast Victoria. And I want to disagree with Jeff. I think why we need to talk about being old, growing old, older people, age-friendly is the absence of older people in policies, programs, services and development. That once we have an equal playing field, then we can stop talking about later life, old age, older people, growing old, starting at 90, growing old. I'm less interested in the chronological age because there's actually very little evidence that says that biological age has any link with health and health outcomes. But I am interested and will continue to talk about growing old, being old, older people and age-friendly communities. And to say that it's intergenerational and it's not older people at the expense of everybody else. It's older people and everybody else. We at the moment in the state that I'm in has a government that's now focusing on 50 and older in their work on ageing. And I think, who's going to focus on 80 and older because 50 and older is included in mainstream work. So while I absolutely agree that the narratives that we tell about aging, thoughts become things. So we need to constantly address negative stereotypes, ageism, age discrimination in all its forms, subtle and not so subtle. We also need to keep talking and keep focusing on older people as the centre of the work.
Yes, and that's been the experience in the other isms, that you need to do both or all, whichever the descriptor. So thank you for that, Kathleen. That was good points. Who else outside? Mark, I saw a wave there.
I don't know if I'm waving properly, but there you go.
Sorry, it worked.
Yes, I got your attention at least. I'm in Canada, and it's about 9:30 at night here, so good morning over wherever you are. By the way, the conference is not in Toronto this year, it's in Niagara Falls.
That's right, thank you.
Outside of Toronto. I live about an hour from Niagara Falls. It's November 1st to 3rd. I'm a conference partner for IFA promoting the conference within Canada. And I must say, if you haven't been to one, I was there in the 2018 one, it's really a marvelous experience to hear from people around the world. My business is called Change Rangers, and I love the things that Jeff said, and I guess with Kathleen or whoever else, around changing language. And I do presentations and research and a weekly blog for the last 10 years on subjects related to the business and social aspects of longevity. My rephrasing of my tagline a few years ago was recoding a longevity society. And recoding means changing the language and the approaches to things. So it's everything from pension reform to healthcare, whatever the stuff is. We're living with 20th century language in a 21st century world. And how do we move from that? By about 2030, if you want to talk about age for a minute, and one of the things I use in my slides and presentations that seems to wake a lot of people up, is by the year 2030, the first millennials will be turning 50 years old. And that's only a short 10 years away from now, if it goes as fast as the last 10 years. And every time I mention that, I always have a millennial come up to me afterwards and say, oh my God, I never thought of it that way. So I guess I better start paying attention to my journey. And so I really just wanted to sort of echo some of the things that are being said. One of the other things I wanted to share from what's going on in Canada, going back to the higher end of the age spectrum, if you will, is our issues around long-term care. And there's just a series of reports that's been done in Canada on the future of healthcare, of long-term care in Canada. It's done by the National Institute on Aging, based at Ryerson University in Toronto. And I encourage you to go look at it. 2 reports were done in September and October. The second one dealt with the cost of long-term care, and that's a big issue, I think, in a lot of countries. How we're going to manage it. It's not just about throwing a pile of money at a bunch of beds in hospitals, but how do we recode the system around bringing the care into the home? How do we put value to caregiving? As opposed, it's like one of the phrases that bothers me, and Jeff, I'm sure you'll agree with this. People say, oh, you know, informal caregivers. Well, there's nothing informal about caregiving. It's hard work. And one of the points that this NIA report mentions is that it's almost insulting to call a family caregiver an informal caregiver. So how do we stop some of this kind of attitudes around things? People of all ages are doing caregiving at various different points on the journey. And so the third report's coming out in sometime this year. There's a national survey going on right now, and I encourage you to see how we're talking about long-term care in Canada, and check it out, National Institute on Aging. So I'll shut up now.
No, that's good. Interesting that you raised the long-term care area. Australia's in the throes of a royal commission into our care, and yes, it's money, it's attitude, it's ageism, it's all sorts of things, and it's going to be interesting to see where it all lands, because it's highlighting some pretty poor practice that's been there for a long time, and really no one gives a rat's about. So
and one of the things
that's a formal term.
One of the things that came up in one of the presentations at IFA in 2018, there was 2 women from I think it was the University of Iowa or somewhere in the States. And they were talking about the social model of care versus the medical model of care. And we have to apply more of a social work model to it. And it was quite fascinating. So there's lots of great value in going to a conference. There's the plug one more time for the conference.
You're doing a better job than I did. Thank you for that.
No, yeah, there you go.
Yeah, no, highly recommend the conference. That's great. One of the other thoughts was how we might support people to share any of the work you're doing, any of the reports. You can always send them to the Secretary at the IFA in Toronto, and things will be published. And if you're not a member, I encourage you to look at membership and the benefits of it, but at least to get our newsletter, and you can sign up on the web to get that. It's really worthwhile, because that's where you can get a lot of information across the world, and we can learn from each other. So great.
And I just see that somebody said that they're also in Canada, just outside of Toronto, Amanda. So maybe she wants to chime in.
No, I just want to let you know that Amal has put her hand.
Hang on, Mark. Sorry. Yes.
Sorry, I just wanted to let you know Amal had her hand up for.
Oh, okay. Thank you very much for that. I can't seem to see that. I'm going to have a look why. Amal, please go ahead.
Hi, thanks everyone. Can you hear me?
Yes, beautiful.
Okay, perfect. I pressed the right button. So it's great to be on the call. My name is Amal Abou, and I'm just a little bit to the south of where Mark is. I'm in New York, and we're really happy to engage with you guys on this. I lead the team at the UN in New York that covers aging issues. It's called the Program on Aging, and IFA is actually one of our great partners, and we work very closely with them. And we've also been engaging with our partners at WHO on the Decade of Healthy Aging. And we lead 18 UN agencies that are interested in aging issues. So we're using that platform to help turn the Decade of Healthy Aging, hopefully, into a UN Decade of Healthy Aging. So this will allow all different agencies to pitch in and into the work that's done in that area. What's really interesting listening to you all is how wonderful it is to hear that the messages that we're seeing at the global level, at the General Assembly discussions, is echoed at the regional and national and local level from colleagues who spoke earlier. When it comes to older people, and I took lead of this team maybe just over a year now. So in one of those sessions of the General Assembly that we referred to that discusses whether or not we need a legally binding convention, I told them that we're looking into a new tagline, and it was bracketed because it's not approved, which is join us or die, there's no escape. And it's a quote from Darth Vader, who's one of my favorite characters. I'm a big Star Wars fan. And I was telling delegates that it woke them up. They're not used to hearing that at the General Assembly. And I was worried about the interpreters translating this properly into all the languages. But what I really wanted to tell everyone, that it's not an ultimatum, join us or else. It's more about, this is going to be you in the future if you're lucky enough to be there. So like Mark has these figures by 2030, which is interesting, Mark, I'll be referring to yours as well. What we tell member states, which is what got them more engaged over the recent years, is that by 2030, older people worldwide are going to outnumber youth. And that in 2018, they've already outnumbered children under the age of 5. So for those of you that are engaged or follow the Agenda 2030 and the implementation of the Sustainable Development Goals, and Goal 3 is on health, who will be around by 2030, which is the target date for these goals. Worldwide, there will be more older people. So the approach to it, making sure that we're including them in these development processes is important. And I agree with both colleagues that spoke earlier. It's really both. It's about targeting specific policies and legislation that targets older people, because they are, many of them are marginalized, are outside the main course of, the priorities in the political agenda, developmental agendas in countries, but at the same time, the life course approach, that narrative from our experience is welcomed more by governments. They respond to it more. So I think we should approach it from both ways. Now, some of the material that we have that you might be interested in, if you Google aging and the UN, you'll find that we did a Secretary General report, I think 2 years back, and our good friend Thelma, who's on the call, was one of the experts in that meeting, and it's on care. And we looked at it from a cross-cutting perspective, linking it to the role of women in care, and also migrant workers and and decent work and how it applies to it. And that it's not just that old people are recipients of care, but they're in many cases also provide care. Yes. We also very recently had an analysis of voluntary national reviews. These are submitted by member states at the high-level political forum, where they report nationally on how well they've been moving in implementing the Sustainable Development Goals. We've reviewed them actually since the beginning, from 2016 up to 2019, so 158 reports. And we looked at how many of them addressed aging and priorities and policies. And we found that over 2/3 of them did, which was, quite a surprise. But the majority of the approach of member states was looking at older people as a burden, looking at, the sustainability, fiscal sustainability, a burden on economic development, that sort of language. I think around 43 member states addressed aging under Goal 3, which is on health. If you look at our briefing paper on our website, we say who they are to help you guys narrow down if you're interested in specific countries. And most of what they address in that context is on access to appropriate and affordable healthcare, preventive care, long-term care, and financing the healthcare systems. And from a more of a human rights perspective, if some of you are interested in that, we have a working paper. If you look up the open-ended working group on aging, this is the meeting that takes place once a year, every April now, to discuss human rights on older persons. So last year we have a paper on the normative content for the possible development of an international standard. And one of the focus areas that's addressed there is long-term care and palliative care. So there you'll see language more along the lines of obligations from member states, remedies, that sort of more, human rights-based language. And yeah, I think I spoke a lot too much, so that's
No, it's very interesting. Thank you, Amal. One question I have, so there'll be a meeting this coming April. What's the theme this year?
Sorry, I keep missing the button.
Sorry.
So this year, the two new focus areas is going to be on the right to work and access to the labor market. And the other one is on access to justice. And the bureau of this working group is there's a list that was identified by member states a few years ago that's going through them, 2 focus areas every year. And I just want to flag that although we've covered long-term care and palliative care, there's another theme on health that hasn't been addressed yet. So I'm not sure if it's going to be coming up for the next session in 2021 or not. The Bureau's yet to decide on that, but it hasn't been addressed yet in the human rights context at the General Assembly.
Maybe we can have a convention before we need to actually discuss whether health and rights for older people are a topic to discuss.
Yes, well, you'd be surprised. I mean, with when you were talking about language, so we support member states when they meet in closed rooms, to negotiate resolutions, and you'd be shocked at some of the language they use. So the last report we had was on, reflecting on these VNRs and also on older persons in humanitarian emergencies. And we suggested language on older people, like other age groups, are active agents in development. And it just didn't go through. And some delegations said, no, the youth are active agents, not older people. So many things that we take for granted that we think is obvious, this, you know, issues when it comes to ageism and stereotyping. There's a lot of educating that needs to be done out there. And I think, you know, it's double-sided. I'm very happy that the numbers are starting to poke at policymakers to want to have to do something about it. But I keep telling them that had there been just one older person on this earth, you know, they have the right to age with dignity. So it shouldn't just be a number argument. Yeah.
Yes, indeed. Thank you, Amal, for that. That's terrific to have that information, and I'm sure some of those who are interested in elder abuse and rights will be very interested in the topic around access to justice. And I know some of the lawyers in Australia attend the UN meetings as well, and Bill up north in Townsville, he'll be there, no doubt. Thelma, given Amal mentioned you, would you like to say anything or ask any questions or comments? Maybe not. That's okay. Anyone else like to ask anything? Or yes, Christy.
Hi everyone. Sorry to take up some more time, but it's you know, getting my brain firing. I agree with all the kinds of issues everyone's raising. It's going to be a bit of a challenge to synthesize what that all means, though, in terms of an agenda for the IFA moving forward and how to kind of bring that together under an umbrella. So I do keep coming back to that issue of task responsibility, because what I've seen, which intersects with a range of different things people are talking about, is one of the papers that I've just finished, which is under review from the Griffith Law Review, is an issue of ageism within, of all things, jury service laws. So there's a whole heap of laws on the books in a lot of common law countries in particular, which still exclude people on the basis of age. So that personal characteristic, age, is still something that applies in so many laws in so many countries. And yet what I found in that research that I was looking at, comparing all the different jurisdictions in Australia, trying to understand what the rationales of the policymakers were in coming to you know, accept and retain this on the books when discrimination on the basis of sex was long since overruled, is that there's a lack of coherency from a policy point of view. But it comes down to two themes that I have seen. Is on the one hand, when we talk about civil participation, and it could cross into a range of different sectors, is participation of older persons has been viewed as a burden on the state. So it's, you know, a resource burden to include people, which is a common kind of narrative that we hear around the economic burden of aging. And then on the other hand, there's this paternalistic prejudice that seems to come into policies all the time. And I wonder if it's behind, you know, people wanting to, you know, feeling uncomfortable about imposing participation on older persons as if they're a distinct group by virtue of their age. But a lot of policymakers have said that, you know, inclusion in the jury service is a burden on older persons in retirement and at a time in their lives where they should be exempt from such processes. So it's this assumption that, you know, by virtue of age alone, you know, there's something inherent behind that that renders people undesirable of wanting to participate in civic life. So ageism is definitely something which is influencing so many of the laws that are on the books. And I don't have a theory of why that is. Maybe Izzy Deron and his work on ageism in the law might have more to say about it. But yet when it comes to another issue of task responsibility, it's systematic in the sense of how we actually educate lawyers. So autonomy, individual autonomy, is a really big feature of the work of the Open-Ended Working Group on Aging, as well as a fundamental pillar of the Decade of Healthy Aging and how we actually get to individual autonomy. But surprisingly, there's actually a lack of definition around what that actually means, how it's protected, and what policies and laws can promote or inhibit individual autonomy. And it's actually incredibly complex. But if we were to talk about, say, end-of-life planning, which is something that's often raised in this area, there's almost an ageist issue here when end-of-life planning and advanced personal planning tends to be connected to the issue of older age, when it's something, of course, that everyone should do. So as lawyers, at least in Australia, and I imagine in many countries, there is no requirement that law students study advanced personal planning. So we have a gap in technical knowledge in this space to begin with. But then when those courses are taught, there tends to be a conflation of topics under an umbrella of elder law, and elder law tends to include succession law, because succession law is not a compulsory component of a lawyer's education. So there is that conflation of legal interests around end of life and aging, which I think is only going to kind of fuel these ageist issues that we need to remind ourselves to overcome.
Yeah, thanks, Christy. There's some really interesting points in there, and I think there's a lot we could talk about on all of that. The interesting thing is that lawyers or judges have to retire at 72 because they're 72. And, I think there's probably a point at which we could actually rally a number of them to do something about that, because there's a lot of self-interest in it. I'm just going to ask Joseph to say a couple of things, and then I noticed Thelma come up, so we'll come to Thelma and then we'll wrap up because we're getting close to time. Joseph. Thelma's come on. Thelma, you're on.
Okay, can you hear me now?
Yes.
Can you hear me? Okay, great.
Yes.
Oh, I've been trying to come on. Hi, what a great group. Anyway, I'm Thelma Kay, formerly Head of Social Development in UNSCAP, so not representing, but working with the region. And I was very excited to have a chance to join this town hall. I love innovative things. Anyway, on the whole issue of healthy aging, I think our region, I'm talking about Asia and the Pacific, is really seeing a lot of, we have seen a changing disease pattern. So now almost all countries, including the poorer countries, now have to face both infectious diseases of the old and chronic diseases. So we have a big challenge of health issues for healthy aging. And to address that, I think our health systems are not equipped for it. Many of them are still doing things like MCH, or just simple vaccinations. So we have to adapt the health systems to be able to cope with this new pattern that we're seeing. So they have to be able to handle testing for diabetes, for example, high blood pressure. In fact, we are seeing very disconcerting numbers on diabetes. And of course, there is dementia, for which people just don't know what to do. So we're seeing these changing disease patterns, and we have to look at how we can handle this. First of all, in terms of improving our health systems. And also, there's a big move now on prevention. And one of the preventive measures is really self-care. So many of our population, unfortunately, are still not very literate. So literacy is a problem. There is a way to really, we must find a way to educate our people on preventive measures. And something coming on big is self-care, how to look after themselves. So on this one way of selling this whole issue is to the governments, is because actually when you talk to governments, it's usually they want hospitals. We're talking about the treatment approach. So preventive healthcare, preventive measures is being sold as health promotion measures, as preventive long-term care, which means that we promote prevention, we educate people to, of course, increase life expectancy and maybe lessen the cost of long-term care. It sounds, I think, very, very capitalistic, sounds very very money-minded, but in a way it works with governments who are very conscious about budgets. So preventive long-term care is coming on strong. So you will see in many developing countries a lot of exercise courses, and many of them are trying to leverage on the existing cultural things, like yoga, Tai Chi. So self-care, preventive long-term care is coming on strong. I think another very important one is really the financing. I think Amal alluded to that. It's very, very important because, as I said, our health systems are not prepared for it. So of course, our richer countries have, many of them have universal health coverage, you know, Japan, Korea, even my own country, Singapore, we have pretty good financial coverage, including highly subsidized systems. But among the developing countries, I think it's very few of them have something which we understand as universal health coverage. Perhaps Thailand would be a good example. They have something called used to be called the 30 baht scheme, but now it's practically free for everybody. So that is working quite well. Bears looking into and learning lessons from it. So health financing is a very big issue, which most of you are from developed countries. So this is things that, as I said, even I'm from Singapore, we take these things for granted. We know it's an important issue, but it doesn't really impact on us personally. But for developing countries, is a very important issue, health financing. So we have to push for some form of universal health coverage. And then I think one issue that people don't talk about, of course, all this leads eventually to issues of care, because, you know, we are all we have to look at a new social contract, because even in developing countries, family sizes are getting smaller. So the traditional methods of care, I think one of you mentioned about the care issues, long-term care issues. We have to be looking at this because the social contract it's getting very frail. So what are the alternatives? What do we do with diminishing families, long-term care, palliative care? So we have a big agenda ahead of us in terms of healthy aging, because it's all linked up, as many of you have pointed out, it's the life course approach. So we have to really look at this issue, and I'm very glad that WHO and all of us are beginning to see this issue as very important, and of course, extremely important for developing countries too. So I shall not take up too much of your time, but
thank you, Thelma. Thank you for that contribution. We've just got a couple of minutes left, and there were just a couple of things I wanted to let you know about if you weren't. How many of you, if we could all work our hands, this would be really good. That's not going to happen though, is it? All right, it's all right. I'm assuming most of you are members, but just in case, the agenda for the IFA for 2021, if you haven't picked it all up, falls under a number of areas. Obviously, the combating ageism. We're involved in the UN, and we have observer status, and Jane and team, we have a number of volunteers who work at all the UN locations on different topics, but we're working particularly on the Doctor Barometer program, which is a global action network of individuals and organisations looking at improving vision health. And you can find out more on our website about that, but it's obviously got a connection to the diabetes-related vision complications. We're looking at aligning health system to the needs of older people, and that's particularly around the vaccines for life. And so that's another global program. And then we've got the developing age-friendly environment. So we work directly as the age-friendly environment collaborator with WHO. And we've got a webinar series, and we're reviewing submissions of age-friendly practices at the global level, which the network now has 500 members, which is significant. Sorry, I read that wrong. It's 900. The Mentor AFE program is looking to help build skills among individuals around the leading, influencing and implementing the development of age-friendly environments. And again, if you want to know more about that program. And then, of course, our conference, which Mark has so well given the correct details. And if I read my notes, it actually tells me it's Niagara between the 1st and the 3rd of November this year. So I'm planning on going. I know probably a couple of others are, so we will see you there. So I'm going to finish up at 1 minute to 2, my time, to say thank you very much for your contribution. I guess if we had the raise hands working, we could say, if you would like to do this again, click on your hand and we will get that as a stat then so that we can actually continue. So I'm seeing a lot of hands go up. That's great. What we'll look at, if you want to send us an email, and I'll ask Vanessa to pop an email in there just so people can see it, possibly yours, Vanessa, so that if you are interested in a particular topic or a particular timing, you know, is this time working for you? How often should we do this? You know, we could do it every few months, or we could pick a theme. All of that we'll be tossing over. I'm really keen to do these regularly, whatever regularly actually stands for, and have an opportunity to exchange and share. And I can see that people are sharing emails and saying, I can send you this document and that document. It would be great to really promote that collegiate sharing around some of our key areas and feeding into, I mean, we've got some fabulous people, Amal and Thelma, who can put it straight into places we don't necessarily access. And obviously through the IFA, we can do that. So there's lots of outcomes that we can have as a result of just getting on that online like this every now and again for an hour. So if you would send an email to the IFA giving your interest, your ideas, then we can go from there. So thank you everyone for your participation. I've really enjoyed this. I hope you have too. And I look forward to speaking to you again sometime soon. So cheers. Signing out.